All right, it looks like we are live. So at 5:05, I'm going to call the January 18th Quality of Life Committee meeting to order. Loretta, can I please get a roll call?
Yes, you can. It's Madam Chair Cassatt,
Here?
Councillor Chavez,
Here.
Councillor Lee Garcia,
Here.
Councillor Michael Garcia.
Present.
You have Councillor Villarreal.
Present.
You have a quorum, Madam Chair.
Thank you so much. Moving on to approval of the agenda. Do we have any changes from staff or the committee? And if not, what are the wishes of the committee?
Move to approve. Second.
We've got a motion and a second. Can I please have a roll call?
Councillor Chavez,
Yes.
Councillor Lee Garcia,
Yes.
Councillor Michael Garcia,
Yes.
Councillor Villarreal,
Yes.
Madam Chair Cassatt.
Yes,
Motion passed.
thank you. And nothing was pulled off the consent agenda. So can I please have a motion?
Madam Chair,
Yes, Counselor.
I'd like to remove item E. I just need to recuse myself, so that's why I didn't. pull it from
Absolutely. I
consent.
apologize. I'm sorry. Item E.
E is in Eric. Yeah, that's the foster grandparent and senior companion program.
Okay. All right. Thank you. Sorry. Do I have a motion to approve is there anything else anybody wants to pull but not need staff for? And if not, can I get a motion to approve?
Move to approve as amended. Second.
Motion and a second. And Loretta, can I please have a roll call?
As Councillor Lee Garcia,
Yes.
Councillor Villarreal,
Yes.
Councillor Michael Garcia,
Yes.
Councillor Chavez,
Yes.
and Madam Chair Cassatt.
Yes.
Motion passed.
Thank you so much. So we'll be going ahead and moving on to the presentation. This is community-based behavioral management in Santa Fe. We have Nicole Alt, who's the contracted behavioral health director from the Santa Fe Fire Department, and Catherine Field as the crisis services director from Santa Fe Crisis Triage Center. And then Lawrence, could we please get Andres Mercado to promoted as a panelist from the Santa Fe Fire Department, as I imagine he is here for this as well. And with that, I will go ahead and turn it over to our presenters.
Wonderful. Hello, Madam Chair and Councilors. Thanks for having us. Are we going to share our screen, or do you guys have the presentation? Sorry if that's.
If you could share the screen, that would be wonderful. We do have the presentation, but for the public to be able to see as well, we need to share the screen. Thank you.
Sure. Catherine's going to do that.
Just 1 second. Post-disabled participant screen sharing.
Lawrence, I believe, needs to allow the sharing of the screens, because I don't have that capability. Okay, sharing is allowed for multiple.
Okay, I'll give it a try again.
Thank you.
Okay, everyone see that okay?
Yes.
Yes, we can. Thank you.
Yes.
Great.
Okay, so we're just going to take turns here. It's an 8-slide presentation, so it shouldn't take too long, and then we'd love to answer any questions that you might have. So as it was said before, my name is Nicole Alt. I'm an LCSW. I'm the Behavioral Health Director. I'm a contractor with the Santa Fe Fire Department. I've been a clinical social worker working in high utilizer programs for 9 years now. I worked in the hospital, and now I provide the mental health oversight for public safety response and the case management in our office, which includes the alternative response unit.
And I'm Kate Field, LPCC, and I have been in community behavioral health for 9 years now in different capacities. Currently, I'm the clinical director for the Crisis Triage Center in Santa Fe and the Mobile Crisis Response Team. My background is also in assertive community treatment and outreach programs. And I was at one time a firefighter EMT with Santa Fe County, which I find informs my work as a behavioral health clinician every day. So we thought we would start with offering kind of a perspective and overall philosophy regarding the work that we do. In a very special way, community-based behavioral health is much more than just counseling or what we might think of at an outpatient clinic. Some of you may be familiar with Maslow's hierarchy of needs, which is something we all learn in school as clinicians, that in order to reach a level of mental stability, you need to have physical safety and have your physical needs met. And when you're performing mental health intervention in the field, that's where you need to start. You need to start with safety, shelter, food, clothing. And you're not going to have the same platform that you would in an agency or a clinic. You're going to need to work from a person-centered goal, which means the client themselves is going to tell you what they're ready for and what they would like to work on. And you're going to focus on building rapport and a relationship with them so that you can serve them and support them over time. This is a juncture when you go out in the community where my services at the crisis center and the city fire department services connect when we're responding to calls together.
So from that emergency stabilization that happens in the field, this is sort of some bullet points on what that might look like. So a call comes through dispatch for a welfare check or a disorderly. It is assigned to the police department typically. And then the ARU, with its flexibility and sort of nimbleness, is able to respond to that either with police or not. We have a police officer who can respond with them at all times. And when we get to the scene, or when we hear sort of a little bit more about what's going on, we can call mobile crisis in. And that also comes through dispatch. And so mobile crisis will send a mental health clinician to the scene. We all know each other fairly well at this point. And if we feel on scene that we need anything else, we can call for any kind of police backup that we might need. The outcomes in these scenarios will depend on a lot of different factors, whether or not the person is able to make any decisions for themselves, whether or not they are clothed appropriately, all sorts of different things. But due to the symptom severity or the safety risk that we have, we oftentimes need to transport to another facility to get a slightly higher level of care and start building out the plan for longer term stabilization. They can go, if they're 18 or over, there's a voluntary option to go to the Crisis Triage Center that Kate and her team run. And there they can receive some case management, some therapeutic intervention, and some shower, a meal, a safe place to be, as Kate talked about with the hierarchy of needs. If they do not fit into the criteria for the Crisis Triage Center, we may take them to either one of the hospitals for further stabilization. So that response is just the beginning of that work. And then once we get them to that next level of stabilization, we can begin to get accurate assessments, put together a plan, maybe assign them to an intensive case manager for navigation, and work together to figure out how we can move to the next level of care and see how the patient or client is doing at that time. So given, I just want to point out that sort of given the strained resources that I think we're seeing for behavioral health across the country, sometimes people get lost in the shuffle there. So they will not be held at a hospital. They will walk out of the hospital. They will walk off scene. They will do things that will change this outcome. And that then presents a whole different scenario.
What we do, we find that we're explaining our services quite a bit as regards to the details of what it looks like. What does it mean to do mobile or community-based support? And the most important point I would say is that it's nimble and that there's immediate access for a client. It happens where they are, in the place where they need it most. And that's difficult to facilitate for some behavioral health agencies, which makes it particularly successful when you have this type of outreach and program working within a municipal or county structure, because you can interact with the other agencies as needed in the field. So you'll see in this list, the alternative response to behavioral health emergencies in the community includes all of these many things: immediate intervention, intensive navigation, person-centered advocacy. Case management is huge. So you're going to be introducing yourself to this client and their scenario, developing a network of care around them with all the other agencies. There is not one agency that can do it on their own for the most part. And it's going to take continuous, hopefully daily, if you're lucky, if you have that kind of contact with an individual, support to navigate them to long-term services. We do find that when we have a multi-agency response, we get a better success rate. We have a greater benefit to fire and law enforcement because we're supporting them in a more comprehensive way, and we're supporting the clients in a more comprehensive way. We can find the gaps or barriers that may have impacted the client previously. And if we converse together and work on those problems, it's easier to overcome, and thus less of an impact in the community. The folks that we see most often in our particular services are unhoused individuals who are unable to obtain access to services. Either they're not meeting criteria for inpatient or emergency department care, but they also don't have the capacity or the facilities to reach outpatient care on their own. That's a pretty large population, actually. We also see a fair amount of elderly community members who are isolated in their homes or apartments, who need the same type of intensive navigation and management. And one pretty large gap that we run across quite often in our work is clients who have a dual diagnosis of a severe mental illness and a substance use disorder. It's something that's very hard to treat and intervene with in an appropriate manner. We don't have a lot of facilities in our state, in fact, where you can deliver inpatient treatment to someone with a dual diagnosis, which puts all outpatient services and public safety agencies way behind the ball.
So, as a lot of you counselors probably know, the ARU, the Alternative Response Unit, is run out of the Santa Fe Fire Department, and it began with one unit in May of 2021. It is expanded now. We have 2 units. So that is, we have 2 EMS captains who are paramedics who each run their own vehicle. And then we have a team at this point of 7 case managers who take turns riding on the unit with the EMS captain. And they also have a caseload of clients, a lot of which right now are coming from referrals that we get in the field from the ARU. And they have an amazing ability to connect with people on scene, a different way, a different lens to look through in order to see that patient or client in the field and see what they might need. And then it's a really great way for them to then take that rapport that they might have built on scene and apply it to a longer term intervention with case management.
And here's a little profile of the work done at the Crisis Center, which is similar to what the ARU folks are doing, but it's more focused on behavioral health, specifically clinical assessment and navigation to behavioral health treatment long-term. So if you will, Mobile Integrated Health Office and the Alternative Response Unit are a large catchment net, right? They see medical folks, they see folks with dementia, various social barriers and struggles, and we're sort of a specialty team of behavioral health folks. So the benefits of the Crisis Center in the community are that folks can get immediate access without an appointment, without a referral. They can come into the center Monday through Saturday, 8 to 10 p.m. and expect to work with a clinician, meet with a peer support worker if that's appropriate, a case manager. We can also support them with medication management and respite care. And we quite often support families and caregivers, sometimes by phone, sometimes they'll come in and we'll consult and help them problem solve and identify services that might be appropriate for them. And we quite often will work around the state to find the appropriate solution for a family or a client. The Mobile Crisis Response Team has been in operation since 2014. And like the Crisis Triage Center, it's funded by Santa Fe County, which is a wonderful gift and luxury to the community. It's 24/7, 365, and the team responds anywhere in the 2,000 square miles of the county with any public safety agency. So could be Sheriff's Department, County Fire, sometimes State Police, whoever might request the team over dispatch. Our teams right now consist of a clinician and a case manager or peer or EMT. We focus on first supporting the first responders and law enforcement and addressing the problem safely and partnering with them, and then facilitating when it's appropriate ER and jail transports. And then of course, the long picture is we're able to stick with a client that we respond to and develop solutions for them over time. And it does take some time.
So, so what works about our two teams collaborating together in the community? I think it's amazing to have coordination within this public safety realm. So Kate and I do spend a lot of time checking in with each other and checking in about how things went on scene and who's seeing who and what needs to happen. So having that coordination is critical, and it's working very well. Access to the public safety infrastructure. So this means that being able to live within the fire department and the community health and safety department is really helpful. Not only do we not have to bill for our services, which makes us a lot more nimble and a lot more flexible in terms of what we can get done, but we also have cars and radios and dispatch that knows where we are when we're out in the field. It is an incredibly important safety infrastructure, I believe. So that's going really well. The mobile 24/7 clinicians from the Mobile Crisis Response Team, having that available 24/7 to police and fire is amazing. And I think that we could continue to build on that, and it's working really well. So partnering us as behavioral health professionals, partnering with community public safety agencies So there's a lot of phone calls and a lot of setting up meetings and appointments in order to coordinate care for people who are really, they're touching a lot of different points in the community, a lot of different agencies, a lot of different first responders. They're sort of bouncing all around. The establishment of the Santa Fe Crisis Triage Center, when it was in the works, I don't think we could have ever imagined exactly how beneficial this would be, given what is happening in communities all across the country in terms of a need for another place for people to go and get care. Continuous person-centered problem solving. So we have similar views on how to provide patient and client care. And that looks like checking in with the patient and client and seeing what they would like, and recognizing that people are continuously in a different stage of change in their life. And if we build the relationship with them in the moment and then afterwards through time, we are there for the different stages of change that they are willing to participate in. And that person-centered bit is extremely important to my philosophy, and I believe Kate's as well. I don't want to put words in her mouth, but my philosophy in terms of client care. Daily immediate communications between providers and responders. Kate and I speak regularly. All the case managers know everybody's numbers. There's a lot of communication that happens there, and it's easy and always available. So inclusion of stakeholder agencies. I think we do meet with a lot of different people in the community and see how things are going for them, what might be needed. We partner with hospitals, we partner with other agencies to see what might be needed, and supported programmatic clinical supervision and oversight. I feel really privileged to get to provide some of this to this work. And I think that it's amazing that the city is prioritizing that, and I appreciate that. I think it's important. So the ongoing support of Santa Fe County and the city of Santa Fe.
So what's next? These are at least the big ideas that Nicole and I have that we talk about often, as far as how can we be more effective? How can we grow appropriately? Certainly one of the main things that we've identified is the continued collaboration between city and county. Neither exists without the other, and each is able to provide programmatic support that benefits all of the community members in a more appropriate manner than just siloing a program in one or the other. I have seen that strengthening existing community programs tends to be more effective than starting a new idea, a new small program. Take what you have and keep building from it, because you have some footing with certain programs already. And of course, public safety, you can't beat that as far as footing in the community, right? So building off of that works, and it's appropriate. Making informed decisions around appropriate program staffing and intentional growth. So this essentially means not siloing yourself as an entity or an agency. Be transparent, inform each other about how the work is going and what's happening and what your needs are, so that you are growing appropriately. You're hiring the right case managers or the right clinicians, or maybe it's more EMS, but find out and do that in an intelligent way. And then finally, a message just to acknowledge that we're working in a system of, well, essentially a landscape of multi-system failures over decades, right? The behavioral health landscape across the nation has been really poor and in ruins. And so we're doing quite well here in Santa Fe. We have these bright spot programs that are really innovative and really progressive. And we're trying to address really large issues with the tools that we have. And in order to keep doing that well, we need to keep that access point open. That means outreach and open doors. It means providing safety to community members through shelters, through supportive housing. And then, of course, as always, continuing healthcare provision and access. And of course, behavioral health, mental health is health. That's part of the picture. It needs to be considered part of healthcare for us to do it well. Thank you all very much. I imagine there are some questions.
Well, thank you so much. And if you could stop sharing the screen, that'd be great.
There you go.
Wonderful, thank you. And then Lawrence, it looks like Director Ochoa jumped off or probably got kicked off. I know she was having internet issues. So if you could promote her once again to panelist, that would be wonderful. Thank you again for your presentation and for really this innovative work in an area that is so challenging and is, you know, going to take a lot of exploration and willingness to really work against a system that is, as you mentioned, you know, just the landscape is quite challenging to be in. Are there any questions or comments from members of the committee at this time? Councilwoman Villarreal.
Thank you, Madam Chair, and thank you, Nicole and Kate, for your presentation and the work you do daily. It's a lot of, I feel like it's an area that I wouldn't have a mental capability to handle. It's a lot of stress, and I feel like there's a vicarious trauma that actually happens within your own field. So I appreciate all that you do daily. I had a question. I guess I'm wanting to understand the intersection between like the city, you know, our ARU and ARU team, and then also the mobile crisis response team. And so I guess I'm trying to understand the whole connection. Like, how do we intersect? How does the mobile crisis team intersect with our ARU units and team? That's my first question. So maybe someone could answer that for me.
That's a great question. Kate, do you want to
Sure.
on that?
So it might help to think about take an actual call out. So there'll be a 911 call for a psychiatric issue on a roadside corner, and the ARU will have the capability to review that call and respond to it. And when they are on scene or when they're on their way, they will call Santa Fe Dispatch on the radio and say, please dispatch mobile crisis. We may have a behavioral health consideration to work with. And so we will then get a phone call and we go out to the scene and we meet ARU on the street corner there. And then we problem solve together, really provider and provider side by side. Like this person, you know, you start building that network of information. Have you seen them before? Have they had 911 calls? What do we know about them? Established providers, and you keep sharing information back and forth. And then you agree and coordinate which program is going to support which piece of the intervention for the client. What can mobile crisis do best, or the crisis center versus alternative response unit? Quite often we will come across clients and scenarios that are really complex and are a team lift. And so it is daily texting, phone calls, emails back and forth, developing some kind of comprehensive support, like a network for that client to fall in. And they might be seen by mobile crisis the next week, and then the ARU the next week. And if we're staying in communication, we're actually developing continuity of care, which otherwise they wouldn't have, right, between agencies. So we can thread from the guidance center to Christus to the shelter and 911, and keep it all together and keep it up to date in real time.
That's great to hear about that collaboration. And I guess it depends on if the mobile crisis team is available, because you all are covering the county, correct?
Correct.
And ARU obviously is focused on the city. So it just depends on the calls and number of calls or what's happening. Okay.
Yeah. We definitely work to make ourselves available. We have multiple teams during business hours, you know, when the center is open. And probably we could be better utilized. I think we run about 1 or 2 calls a day for mobile crisis, and we see maybe 10 to 15 clients at the center. So the capacity to grow is there, but also there's continued training and discussion with all the public safety agencies. Like we routinely do training at county fire, county sheriff. This is how you get a hold of us. This is how you can use us. And we're there to support them.
Do you find that most of the mobile crisis calls are in the city?
Yes, absolutely.
All right, and then the other kind of relationship I wanted to understand is the so the triage. I know the crisis triage center is funded by Santa Fe County, but are we in relationship with you through like an MOU, or do we actually provide grants through the city for you all?
So essentially, although I have a drafted MOU to be put in place, but we're kind of operating as a public service to City of Santa Fe entities in a sense, because we serve anyone that might come in the door. And it could be someone who lives in the county. It could be a police officer with someone he found on Airport Road that needs help. Could be someone going through town. So there is no formal designation there in partnership.
Okay. Well, it's great to have that resource too for us. And so that's why I thought maybe there was like a MOU or kind of a funding agreement or something like that. So it sounds like no. So it's kind of more informal, just looking at the big picture of support.
Yeah, and responding to calls. I mean, I think when you get used to seeing things come up and knowing what the calls are, sort of recognizing how to piece together that continuation of care and that structure of support, it led us to collaborating a lot and continues to support that.
Great. And then the other question I had is just since COVID, or since we're still kind of in that mode of a crisis pandemic, I'm just curious about the uptick, if there's been upticks of numbers of cases related to behavioral health, or you've seen extreme cases more so than in the past?
I would respond that what we see quite often are cases that had been neglected due to COVID, that folks who weren't able to access social services or get to their therapist or psychiatrist's office, get to SSDI, they now have 2 years of compacted complexities that require extensive untangling. So they are more severe.
Agreed.
Or they're exacerbated or have been exacerbated by COVID?
Yeah. I think we see a lot in terms of the ARU being out there and responding to these calls, is finding a lot more vulnerable people, including one area that I find really interesting and challenging, which is the senior population who have been really isolated during COVID. So that is something that has definitely been expressed. I think that is also evident in the juvenile population as well, school age children. But the elderly piece is something that I didn't know it was as bad as it is. And I think COVID definitely exacerbated that.
I guess my other question is, now moving forward and thinking about growth, so that we're not being reactionary to a lot of what's happening in our community. If there was a way that what you all would need in order to have ways to be proactive to address certain issues, systemic issues in our community, instead of always being reactive. And you could, whether it's more funding or whatever, maybe you could just map that out for me of things that would be helpful if you had on your wish list, I guess.
I'll say right off the cuff that adolescent behavioral health is lacking even more than adult behavioral health. And so I think if we could have a whole network of care built out for adolescents and even younger children, that would be really good. I think that there's some interesting research and programs that have focused on early intervention in terms of psychotic disorders and catching that early with young adults or older adolescents is proven to be very beneficial in the long run. So I would beef up all the stuff for kids.
Mm. Do you have any thoughts?
Yeah.
on that?
Certainly hard not to answer when provided with the opportunity with a wish list. I would definitely start with a formalizing of partnerships, whether that's financial or program development wise, so that things are happening more efficiently. Followed by some attention towards substance use disorder intervention and treatment that goes beyond just, we have a detox here and we have some long-term programs, but the people who are most acute are not able to access those. So that is a special area that we could use. And then finally, I know a lot of clients and individuals who would succeed if they had a supported living scenario. Goes without saying, right? That if they were under a roof and they had someone checking in on them, they would succeed and they would be healthier.
That's definitely true. And I think building out even more sort of intensive supportive living for people with like severe mental illness would be beneficial, because those are the ones that tend to bounce around even more and end up in jail and the institute in Las Vegas and then the hospital. And we need some place for them to be.
Mhm. Yep.
Housing.
Thank you. I guess as a follow-up for ARU, in terms of budgetary needs, are there things that we should be aware of as we start heading into the budget season that we should be making sure are available, or that we should know about that needs to be continuously or funded or increased in some way?
I think that we are on track discussing that with Director Ochoa and Chief Moya and Andres and I and all of us. I believe that continuing to prioritize the appropriate level of supervision for the case managers and even, the EMS captains who are doing this really, really challenging work. So I value that we have that in place, and I would ask for that to continue.
Thank you for that. Any other wish lists that we should know about?
Oh,
We'd be here all night.
we have a lot. We were going to get t-shirts made that said behavioral health is health. We're going to wear them all the time, and we're going to give them to you guys.
I think that's important. I mean, I just think that the work is kind of unseen in the community, and then also kind of like what you do on the daily. So I appreciate you both and your teams. I think also, I don't know if Kira had some more to add to that.
Madam Chair, Councilman Villarreal, if I may, thank you for the presentation. Both of these folks are absolute stars in our community. We're really lucky to have them. And it's really exciting, the collaboration that's occurring naturally. I think it'll be great to formalize that in an MOU. Did want to also add some context. The county has an identified revenue source for behavioral health intervention, and the crisis center and the Santa Fe recovery, among some other programs, are a substantial focus of that funding. I think the city's focus in close collaboration with the county has been around the housing piece, around the social determinants of health piece. Obviously, the work that Chief Mercado has done to create this program, I would just want to acknowledge that, has been extraordinary in really utilizing our public safety workforce in a new way. I think what Nicole mentioned around the behavioral health supervision, and I think in terms of a fairly modest approach to our our next year's budget. We really just want to hardwire and secure and solidify a lot of what we already have. So things that have been contracted, we might look to convert to positions. And again, housing, because we hear, and shelter, and appropriate shelter is really a focus, because that's what we can do. And I think, you know, the state and the county have substantial revenue streams for behavioral health. We should always work in close collaboration with them, but unless we magically identify a new funding source for behavioral health, I think what we can focus on is providing that hierarchy of needs in terms of the basic needs. That's my 2 cents, not to say that amazing behavioral health work is not happening under the umbrella of the city. Certainly, Julie Sanchez's programs that are funded out of Youth and Family Services fund a lot of behavioral health contracts with our nonprofit providers in the Connect network. So, but I think we're always thinking of how to, you know, we hear the phrase "stay in your lane," and I think our lane as a city is around social determinants, I would argue, and the public safety response, and the knitting together, and the collaboration with the county, and what the work that Kate and her team do is really makes it work.
Thank you for that additional context. I think those are all the questions I have. Thank you, Madam Chair, and thank you everyone for being with us tonight.
Thank you, Councilwoman. Any other additional questions or comments from members of the committee? Does not look like at this. Oh, Councilor
I'm
Chavez?
so sorry.
Go
Thank
ahead.
you. Fantastic. I just
You
have
have
a
a hand raise, everyone.
I just have a quick, like a request, just out of curiosity. Is there any way that you all can share what partners you work closely with for support? I'm curious about that, because I feel like I always say we're rich in resources in Santa Fe, but unfortunately, there's a disconnect in the fact that many of those resources don't work collaboratively, right? So people might know something and not realize there's other options if that something doesn't work. And I'm just curious to which partners you're working most closely with right now. I don't know if that could be like shared with us, emailed to us. And I just want to thank you for mentioning youth. My work is in education, and behavioral health concerns. We're only seeing the beginning, because like now they're in younger children and they're severe. And this is like the first, like I always say, like this is the first group we're going to see from the pandemic. We probably have we have all of those up to when those babies were in their mama's tummies, and we're going to see the impacts of that as well. So I'm like, we have at least 5 years of this behavioral health concern coming to light and being something we're going to have to pay attention to. So I love that focus. And I know that there's a lot of parents out there that just don't know how to navigate. And there's a lot of strain on the school system, because what they do know is their kiddo goes to school every day. And so there's the hope that the public education or charter or private school has the capacity to help, and it's becoming more and more difficult to do. So I think like focusing on youth is really important, and us all coming together to address that is going to be huge for what we have coming, because it's gonna be a lot more than what people think. It's going to be very, very apparent that we have an issue amongst our youth with behavioral health. Would you be able to share those partners with us?
Yes, thank you for that, Councilwoman. I think we collect a lot of data in our software system in terms of providers and referrals that we make. And also, just to sort of piggyback on what Director Ochoa said, the Connect network is definitely a very comprehensive list of the resources. And then, you know, there are ones that I think Kate and I probably lean on more, given our work, our specific work in this area, you know, with hospitals and hospitals. So that's a lot of that, but I'd be happy to share whatever you would be interested in. I think that the network, the Connect list is really well thought out and explored.
Awesome, because I know we, as educators have our list of resources that we lean on, and some more so than others. And I think that it would be good to know which of those resources we're able to utilize more frequently, or maybe more reliable, so we know how they're well resourced, so that we could support other partners to be well resourced as well to help meet that need, because it's so large. So I'm curious, just the emphasis in a relationship with some over others, so that we could kind of look at those partners to see what they offer, how they offer, and how we could support others to do the same. So that would be awesome to have that conversation at some point. Thank you.
Thank you.
Thank you, Counselor Chavez. Any other, Councilwoman Villarreal, did you have something else to add?
Yes, I actually had a question. I don't know if anyone can answer this, but recently the ARU is similar to our ARU, but their ARU unit in Las Cruces just recently got pretty hefty funding, federal funding, to support ARU. So I'm wondering why they got it and we didn't, or if there's something that I'm missing here, but I'm just curious if there's any federal funding opportunities to support ARU.
Madam Chair, Councilman Villarreal, yes, we're looking into some federal funds right now. There are multiple opportunities in this field, and we're out in front, and so I think we have a lot to build on here. We've all along been very deliberate in how we've grown this program, and want to continue to do so. We can definitely seek funding for case management. For the EMS captains, the paramedics, we need another layer there. And, honestly, we also, as Nicole and Kate said, the ARU is finding and uncovering so much in the community, so many vulnerable people. And we do. So I'm not saying we don't want to grow it. We do. We need it. The police will thank us to no end, because we're relieving a lot of their call volume, and I think, inch by inch, the fire department will have the same response when they start to look at the data as well. But it's a balance between making sure there's a place for people to go and long-term stabilization, because we also have to consider, the team's well-being when you can't do anything for someone. These people are people who want to help people so deeply that they're willing to do this extremely difficult work. And so it's a balance in my mind of creating those resources, those housing resources is where I'm focused, but there are obviously bigger fish to fry as well with Behavioral Health Institute and hospital response and things like that. And so we are seeking actually actively, Chief Mercado and I were communicating about some grants, some SAMHSA grants and other funding, and we will do that, but we need to, I don't want to say be careful what we ask for, but in a way it is that, right? Because we want to be able to support the whole person, not only in the field when they're in crisis, but beyond.
Okay, that sounds good. I'll send you the article. I don't know if you saw it, but it sparked my interest. Like, how come they got it? We did it. So
we didn't ask for it, and we weren't really ready to ask for it. To be honest, I think we were building what we had, and there are ways to backfill and supplement. But grants come with, restrictions. And one of the very nice things about the way we've been able to fund this program through general fund is that the freedom is really there. I mean, we could bill Medicaid for what these folks are doing, and we're looking at that. That may be something we have to look at as we look at the need, but that's no small feat either. And we want to be careful that we don't tie the case manager's hands when they really are doing this really dynamic kind of work, and they don't have to bill for units of service and things like that.
Thank you.
Thank you. Any other members of the committee with any questions or comments for our presenters? Well, thank you both for being here. And again, for this really challenging work. And really trying to fill this tough need in the community. As Kira mentioned, it goes beyond so much of what you're able to do in that moment. But I know that having that available is really crucial. And also what you're uncovering is, that information is really useful for us and looking at what those opportunities are and really understanding, housing, not that we didn't understand this already, but I think the different connections that we make to how deep this need is really important, and how we're able to solve it in a variety of manners. So thank you again. Lee, I saw your did you have a raised hand, or was that just a moving hand?
It was
sorry.
just I'm
Okay.
still at my office, so some of my guys are saying bye.
I was
They're
like,
heading out, but
sorry about that.
yeah. Kudos
but
to everyone though for the work that you do. It's a very, very hard work, and it's very sometimes many people don't give their appreciation for what you guys do. So thank you guys for what you guys are doing.
Thank you. And thank you both. And I'm sure that we will see you again at some juncture. And thank you so much for your work, and you as well, Andres. Thank you so much for being here and for all the work that I know you've put into really getting these programs off the ground. Really, truly appreciate it. Thank you. Moving on to our next item, we are going to item E on the consent calendar. This is a request for the approval of State of New Mexico Aging and Long-Term Services Department grant agreement in the total amount of $268,841.12 for the foster grandparent, senior companion, and retired senior companion volunteer programs, term ending June 30th, 2023. We do not have a staff member here because Michael Garcia, stated that he would just like to recuse himself. So Councilor Garcia, go ahead.
Thank you, Madam Chair. I'd like to recuse myself from this item as I work for the federal agency that hosts the senior volunteer programs that are requesting to be funded.
Wonderful. Thank you, Councilor. And if you just want to log off, and then I'll text you when it's time to log back on. And then you can. All right. So can I have a
Move to approve.
Second.
the motion from Councilman Villarreal, a second from Councilor Lee Garcia? If I can please get a roll call.
Yes, Counselor Lee Garcia,
Yes.
Counselor Villarreal,
Yes.
Counselor Chavez,
Yes.
Madam Chair Cassett,
Yes.
motion passed.
Okay, thank you so much. We'll just give Councilor Garcia a moment to log back on. Perfect. I see him as an attendee, and if we can have him promoted to panelist. And there we go. Welcome back, Counselor. Moving on to matters from staff. Are there any matters from staff this evening? Director Brown.
Good evening, Madam Chair and members of the committee. I do have just one matter I wanted to say. We have recently announced the, the appointment of Johanna Nelson as our new Economic Development Director. And I'm excited to have her here tonight so that if you had any questions for her, she's here, but we're excited about the capacity building in the department, and Johanna will be our new director for the Office of Economic Development. So I just wanted to share that with the committee.
Wonderful. Thank you. That is very exciting news. Johanna has actually been a member of EDAC for a number of years. So I've had the opportunity to get to know her in that capacity, and am extremely excited to have her as a member of our city team. So welcome. Any other staff members at this time? Johanna, did you want to say anything as a staff member who can have matters?
Yes,
Madam Chair and members of the committee, Director Brown, thank you so much. It's so great to meet you. I'm ready to hit the ground and already running. So thrilled to be here, thrilled to open up the capacity at the office, and let's get some stuff done.
Thank you so much. I had the opportunity to meet with Johanna today for just a, discussion talking about EDAC, and y'all are gonna love her. We're very lucky to have her. So wonderful. Thank you.
Thank you.
Any other staff matters at this time?
No matters, Madam Chair.
No,
Any matters from the committee? And matters from the chair, I will just say it is Councilor Rivera's birthday today. I know he's not here, but just wanted to make everybody aware, and happy birthday, Councilor Rivera. So if you haven't, go ahead and send him a happy birthday message. And then other than that, our next meeting is Wednesday, February 1st, 2023. And at 6 p.m. we are adjourned. Thank you so much, everyone.
thank you.
Thank you for the Zoom option. I loved it.
Good. Thank you.
Just like old times.